All right, good morning. Can type 1 diabetics come off insulin? That's a question. It's an inflammatory question, right? A lot of people will get mad when you ask about that. And why am I asking that? Because I'm getting reports of type 1 diabetics doing that. Is it true? Can I verify it? Hard to say yet. It's interesting though to think about. And let's think about the plausibility of this. And before I get into that, what I would say with pretty clear certainty is that a carnivorous diet is a very, very good diet for type 1 diabetics. And so whether or not someone is able to come off insulin or not is not really a point in this situation. What we do know is those people going on a carnivore diet report incredibly great blood glucose control, extremely blood glucose, extremely low hemoglobin A1C, basically approaching non-diabetic levels, and they usually have minimal insulin requirements, maybe a little bit of base whole, maybe very little to cover meals, depending on how much protein, and so that we know. I can say that with clear confidence. Now, the issue about these people saying that they're type 1 diabetics and are coming off insulin, now that is obviously something that I would have far less confidence in saying, yeah, that's clearly happening. But can't discount the fact that people that are out there that have been diagnosed as a type 1 diabetic are now saying, I'm no longer using insulin. I mean, it's happened. I'm aware of probably close to 10 cases now. I'm hopefully going to be able to interview a few of them and get a little more details on it. So let's talk about maybe for you guys that don't know the difference. So type 1 diabetic, generally what happens is it used to often be diagnosed in youth, but it's being diagnosed more and more frequently in later ages. And what we see is a gradual or sometimes very dramatic reduction in beta cell function. Beta cells are the cells that the pancreas uses to make insulin, and then there's the alpha cells that make glucagon. And there's other ones the pancreas does. And then there's, of course, the exocrine pancreas that makes our lipases and amylases. But anyway, so there's a complex interplay, a lot of different things going on. There's paracellular signaling between beta cells and alpha cells. And anyway, a lot of things going on. So anyway, so the type 1 diabetic, as opposed to the type 2 diabetic, the type 2 diabetic is usually someone who has, profound insulin resistance. And initially, what they do is they have high levels of insulin because glucose is having a hard time getting into the cells because the insulin-dependent glucose transporters are basically not working as well. I mean, there's a lot to it, but just as a simple explanation. Most people these days are type 2 diabetics, about probably 90%, and it has a high correlation with obesity. Not always, but generally. Back in the day, 100 years ago, most of the diabetics were type 1 diabetics. So as our environment has changed and we've gotten progressively fatter, that relationship has basically flipped around. And back before insulin was invented in the 1920s, they had to deal with a lot of type 1 diabetics, and some of them they successfully managed to keep alive because a lot of them would die. Most of them would die. In fact, they die of something called inanition. They basically starve themselves to death because they could not get energy into the cells, and they just waste away no matter what they ate or how much they ate. They would just, wither away, and these people were dying at, 70 pounds of body weight, and, he often had these life-threatening infections. And so dealing with those people, they found some dietary strategies that would preserve their life. Some of them recovered. Some of them gained weight back. Some of them they had relatively basically normal blood sugars. So that was known. Okay, so let's go back to today. So these people saying, so the traditional belief is, a type 1 diabetic, particularly one that's been a type 1 diabetic for many years, has basically burned out all their beta cells. They no longer work. There's no longer any insulin produced, and therefore they have to be on insulin for the rest of your life. And for all practicality, that tends to be true, or at least in common experience. Now, the last few years, research has shown that maybe not all the beta cells are dead. Maybe there's some that are still alive, and in fact, I posted a study on Instagram looking at children, and these are, and again, children aren't necessarily adults, but children that have been diabetic for at least 5 years on average still are producing some level of insulin, and that's shown by something called C-peptide. C-peptide is it's basically a product of insulin production. So insulin is produced, so it starts as a long polypeptide called pre-proinsulin, and then that's turned into proinsulin, and then finally insulin. So they cleave off these segments to make it a smaller molecule, which is the insulin that we use. But one of those pieces that breaks off is called the C-peptide, and the reason the C-peptide is kind of better to measure because it has a longer half-life in the blood. Insulin has a very short half-life in the blood, in a matter of a few minutes, whereas the C-peptide may circulate, 4 or 5 times longer, so you can get a better measurement of that. And so what they're seeing is, in these children, about a third of them, 34% in the study I looked at, still were making C-peptide, which means they're still making, and they call it clinically significant amounts of insulin. What that means for them often is they have lower hemoglobin A1Cs, they have probably less insulin requirements. So there's still enough being produced that maybe they have a little bit better time, a little less insulin requirements. But strangely enough, there's a study on adults, even some of them with 50 years of diabetes, they also show that they're producing C-peptide in clinically significant levels. So that means that they're still making some of the beta cells are still hanging out, The other thought, this is an intense area of research efforts, is that these cells aren't necessarily dead, they are dormant. They are no longer making insulin. So the cells are still there, they're just not making insulin. They've lost the capacity to make insulin, or they de-differentiate into a kind of a primitive precursor. So now they're when cells early in our development, our cell starts out as kind of this generic thing, and then it gets specialized. Genetics say, okay, we're going to turn these genes on, and therefore you're going to become a skin cell, and you're going to turn into a bone cell. You're going to turn into a liver cell, so on and so forth. That's how it works. And so these cells become de-differentiated, so they go back to that kind of primitive state. So the question is, can you turn those cells back on? So we do know that in a regular diabetic, a type 2 diabetic, that you can see beta cell recovery to some degree, and there's things that stimulate. If we look at what stimulates beta cell growth and beta cell mass, some of the incretin hormones, glucagon-like peptide, will do that. One of its roles will be to turn certain genes on so that insulin is generated. And so it's not totally implausible that, given the right environment, that you could see some degree of recovery. Could you see that in a type 1 diabetic? That's hard to say for sure. I mean, could it be that there are different subtypes of type 1 diabetics? Certainly that's been described. There's at least 3 subtypes out there based on the progression, whether it's an autoimmune or a viral etiology. But very likely, just like a lot of these diseases, there's honestly probably dozens of types. That's probably the end of the day when we look at the genetic contributions. And so maybe the small percentage of people. Now look at how many people that are type 1 diabetics in the world. There are millions of them. How many are currently trying a carnivore diet? A few hundred maybe, if that. And then we've got a small percentage that are saying, hey, I'm coming off my insulin completely. Does that mean that, maybe we're identifying a small subset of genetically different diabetics that have maybe this different subtype? I think that's interesting to explore. So, I mean, and what do I think as far as, diet? I think is probably a higher fat approach. Now, there is someone that I know that's a type 1 diabetic. I actually had the pleasure of having dinner with her and her husband about a year ago. Her name's Amy Perrin, and she and Dennis is a painter. He's apparently a famous painter, and we had dinner. We had shared a nice steak, and I know she was type 1 diabetic, but she has started a group of people, and she's got about 40 type 1 diabetics that are trying a carnivore diet. And what she's saying is 4 of them have managed to come off completely of insulin. And, they've been diagnosed since their 20s, and I don't know how many years it is. But so it would be interesting to hopefully interview her and some of those folks, which I'll try and make it happen, to discuss this more, because I think this is an interesting topic. Again, the frustration is for the type 1 diabetics that they'll say, well, you're just stupid because Everyone knows no one can come off type 1. Everyone knows that no one can stop taking insulin if they're type 1 diabetic, and you're giving people false help and you're dangerous. And I think, 2 or 3 years ago, when I started seeing people coming off meds for Crohn's disease and ulcerative colitis, people say the same thing. Oh, you're stupid. It's a progressive disease. You're going to have to be on drugs the rest of your life. Everybody knows that. Well, now it turns out lots of people are doing this. So, maybe it's 10% of type 1 diabetics that are in this, in this maybe unique subtype. I don't know. I mean, this is just speculation. Certainly worth exploring. And no one's telling people to stop taking your insulin, type 1 diabetic, and just eat meat. This is obviously a progressive thing where you would, you just eat, you would do it and lower your insulin requirements as needed. If they get down to, basal of 5 units a day, and that's as good as you can get, that's wonderful. No one's saying you go to 0, but for those that can and those that choose to, and that's the other thing. Some people will say, well, if your diet is so restrictive, maybe you got to eat a 90% fat-based diet, and who the hell wants to do that? I'd rather just take my insulin. That's fair enough. Maybe some people want to do it though, and like I said, I think it is, I see where it's frustrating if you're type 1 diabetic and you feel like, well, I've got this on the rest of my life and I've accepted that, and that's great. I mean, that's fine. No one's saying that for you that works, but why would you shut down someone else's interest in pursuing it? And again, no one's saying, hey, drop your insulin and go eat meat. I mean, no one's saying that. Believe me, I'm not saying that. I'm sure as hell not saying it. I am saying that, eat meat and taper down your insulin if you can, which many people do. All right, we'll talk to you guys later. Take care.